In dermatology INI-CET revision class today, what we are going to see is some MCQs related to immunobullous disorder we can ask. So I'm going to discuss in a question and answer format, not in a proper MCQ format. So this is the first question. What is the diagnosis? What is the cell shown in this picture? So this is nothing but an acantholytic cell. Acantholytic cell is a large rounded keratinocyte with large hypertrophic nuclei with clear or absent nucleoli will be there, and what you are seeing here is a perinuclear halo. So this will also be present in the case of acantholytic cell. This perinuclear halo is due to the peripheral condensation of the cytoplasmic material. So here it creates a halo-like image. So this is a typical image of an acantholytic cell. We can give you this picture and ask what is the name of this cell or anything related to immunobullous disorder by giving this question. So acantholysis is nothing but loss of coherence between epidermal cell due to the breakage of intercellular bridges. So two keratinocytes, as I told yesterday, two keratinocytes are connected through intercellular bridges, which is made up of desmosomes. So that desmosome will be lost, or if anything happens to that intercellular junction, this leads to loss of coherence between the epidermal cells, which leads to acantholysis, and it is an important pathogenetic mechanism in case of all the diseases which will have Bullous interclinical finding. And mainly this acantholysis process is the main pathogenesis mechanism which occurs in pemphigus group of disorders, and it also rarely occurs in other non-blistering conditions. So this is all about acantholysis. So the next question, what is the procedure which is being done in this picture? So this picture showing some bedside test being done. So this is a typical picture of doing a Zang smear. So Zang smear is a bedside test which is used to demonstrate acantholytic cell in case of all the bullous disorders, mainly in pemphigus vulgaris we can see acantholytic cell. So you have to know the procedure, how we are doing Zang smear and what is the stain used, all the steps in case of Zang smear. In Zang smear, what we do is first we'll rupture the bulla, deroof it, and we'll scrape off the fluid and tissue material from the base of the bulla and spread it over the slide and air dry it and heat fix it. Then we'll use a stain called as GMSA stain, and we'll keep the slide for 10 to 15 minutes. Then we'll stain it and see it under the microscope. And in microscope, what you can see is the picture shown in this slide. This is the picture we can see in microscope in case of pemphigus vulgaris patients. This is acantholytic cell which are grouped together. This is the classical finding which is seen in case of pemphigus vulgaris. Next question, what is the sign which is being elicited in this picture? So this is also a bedside test which we will do to see in case of all the bullous disorders, and many questions out of this can be asked directly or indirectly in exams. So the sign which is being elicited here is Nikolsky sign. It is found by Nikolsky, who's a Russian dermatologist. And what we are doing here in case of Nikolsky is we are giving pressure at one end of the bulla, intact bulla or intact vesicle. After giving the pressure and taking out the pressure, what we can see here is the erosion. The erosion this happened due to the separation of the epidermis from the underlying dermis. So this leads to separation of epidermis from the underlying dermis, and this is called as Nikolsky sign positive. So this is positive in case of only in case of intraepidermal bullous disorders when the bullae forms within the epidermis. So in case of all the pemphigus vulgaris and its variants such as pemphigus foliaceus, pemphigus vegetans, paraneoplastic pemphigus, we can see this Nikolsky sign being positive. And in case of subepidermal bullous disorders, as I told earlier, the split is below the level of epidermis. It is in between the epidermis and the dermis. So you won't see the Nikolsky sign being positive in such conditions. So this is a very important clinical sign which is used to differentiate between an intraepidermal bullous disorder from the subepidermal bullous disorder. And there are types of Nikolsky sign we can see. First one is direct Nikolsky sign and marginal Nikolsky sign. What we can see here is a marginal Nikolsky sign where the pressure is being applied in the margin of the lesion. So this is marginal Nikolsky sign. Direct Nikolsky sign is when we do it in the normal skin without any bulla. Suppose if we are doing it here, then it means direct Nikolsky sign. If it is very positive, then it is very specific compared to being very sensitive. And a direct Nikolsky sign positive always indicates that the patient is in very much of the active disease stage. So this is as I told earlier, this is a moderately sensitive but highly specific diagnostic bedside tool for diagnosing this bullous disorder and differentiating between the intraepidermal and the subepidermal bullous disorder. And other signs, other Nikolsky signs are false Nikolsky sign and pseudo Nikolsky sign are there that you need not know, but if they ask in any of the options, you should know what is it. Pseudo-Nikolsky sign is seen in case of Stevens-Johnson syndrome, toxic epidermal necrolysis, all the drug-induced epidermal separation disorders. And false Nikolsky sign is seen in case of if we suppose do it in the case of subepidermal bullous disorder, if we rupture an already ruptured bulla, in case of bullous pemphigoid, already ruptured bulla. So in such case, if it gives positive Nikolsky, then it is called as false Nikolsky. This is Nikolsky's direct, marginal, false Nikolsky and pseudo Nikolsky. Next one is HANSEN sign. This is also a bedside test which is being done, diagnosis and to differentiate between intraepidermal and subepidermal bullous disorder. And in this HANSEN sign, as you can see, what they are doing here is we are giving a pressure over the bulla. And see, first we have to mark the margin of the lesion, then we have to give the pressure. So we can see the margin going outward in a different manner. In case of bullous pemphigoid, where the bulla will be very dense, so the margins will be circular in nature. And in case of pemphigus vulgaris, the patient will be having flaccid bulla. So the margins will be angular in case of HANSEN sign if we exert pressure. And as I told earlier, this is the HANSEN sign, pressure on bullae leading to shifting of margins. And if we give lateral pressure, in case of large bulla, we can give lateral pressure, not only central pressure. That is called as lateral pressure. Giving lateral pressure is called as Lutz sign, and central pressure is called as HANSEN sign, proper HANSEN sign. This is also one of the important signs which is elicited in bullous disorder. Next is drugs causing pemphigus. So they can ask you, they can give you in options and they can ask you the question like which among this drug will not cause pemphigus or anything of that sort they can ask. And this is also a very important thing to remember. Drugs causing pemphigus, actually it is divided into three groups: thiol, phenol, non-thiol, non-phenol group. So these certain drugs are included in all these three categories, but you need not remember it this way. Just remember the group of the drugs: thiol, phenol, and non-thiol, non-phenol group. And if they ask, the most common drug which causes pemphigus is CPR. So here pemphigus means I'm talking only about pemphigus vulgaris. So you can remember this drugs causing pemphigus with the mnemonic CPR. C means captopril, P penicillamine, and R rifampicin. So this also they might ask in MCQs. Next is foods. Certain foods are associated with causation of pemphigus vulgaris. So what are all the foods? Garlic, onion, shallots, tea, coffee which has tannins, and mustard oil which has a chemical called as isothiocyanate. This is this itself they can ask as a direct MCQ, and what is the chemical component which is present in mustard oil is the isothiocyanate. This mustard oil not only causes pemphigus, it also associated with contact dermatitis, written contact dermatitis, and allergic contact dermatitis, and the chemical which is responsible for causation of all these skin disorders is isothiocyanate. So this is very important thing to remember. Apart from that, what you have to remember mainly is onion group of vegetables, and tea, coffee, tannins, and caffeine can cause pemphigus. And next is drugs causing bullous pemphigoid. These are the drugs which we saw here. CPR pneumonicus drugs causing pemphigus vulgaris. But here, what I have mentioned is drugs. Certain drugs are associated with bullous pemphigoid. So what are all those drugs? I have given the most commonly associated drug, furosemide, and all the loop diuretics, spironolactone and all the potassium sparing diuretics. In antibiotics, many drugs are associated with the causation of bullous pemphigoid, and ampicillin and penicillin are one such important group which is associated with the causation of this disease, and gliptin group of antidiabetics is also associated with frequent causation of bullous pemphigoid. So you should remember the diuretic group, antibiotic group. In antibiotic group you should remember ampicillin and penicillin, and in antidiabetic group you should remember gliptins. Next, I had given two pictures, and if you try to find out what is the diagnosis. So this is a biopsy picture, and what you can see here is an skin biopsy of the skin showing stratum corneum. This is stratum corneum. This is epidermis, and what you can see here is a big big split at the level of basal layer of epidermis, and what you can see here is the basal layer of keratinocyte, which is just intact and it is attached to the rest of the dermis. So what you can see here is the split. So this is an intraepidermal split, which is nothing but intraepidermal acantholysis, which is classically seen in case of pemphigus vulgaris. So in this intraepidermal split, along with this, what you can see here is few acantholytic cells and inflammatory cells in between, inside the bulla will be there, and in the basal keratinocyte layer, this single isolated lying keratinocyte. This gives a specific appearance called as row of tombstone appearance. This you should remember. A row of tombstone appearance occurs in which condition? Which is nothing but pemphigus vulgaris. This is the biopsy picture. So this they can give you just the image. This was the image asked in this last INI-CET session, and they asked the diagnosis. So you should be knowing all the biopsy findings and thoroughly to crack this INI-CET exam. Next is this second picture. If we can see, this is again stratum corneum. This is the total layer of epidermis. Just notice the split. Where is the location of the split? The location of the split is just at the junction of epidermis and the dermis. So in dermis, what you can see is lot of inflammatory infiltrates. This is the classical picture of bullous pemphigoid or any other subepidermal bullous disorder for that matter. Classically, it is seen in case of bullous pemphigoid. If they give you the picture like this and ask you the diagnosis, then it occurs mainly in bullous pemphigoid. If bullous pemphigoid is not given the option, then you may consider other subepidermal bullous disorders such as pemphigus gestationis, linear IJ disease, all those stuffs. So what you can see here is the subepidermal bullae and the split. Next is, this is direct immunofluorescence lab. What is given in this picture is a direct immunofluorescence finding picture. So this is being called with a specific name or specific pattern of appearance. So this is called as chicken wire. Here what you can see is a chicken wire. So in direct immunofluorescence, what happens is, this is actually skin keratinocyte. In between the keratinocytes, the antibodies are there in case of pemphigus vulgaris. So this antibody reaction in case of direct immunofluorescence, what we are doing leads to this fluorescence in between the keratinocytes. So this in between the keratinocytes fluorescence give rise to this typical pattern of chicken wire pattern, chicken wire appearance, which is especially seen, which is seen in pemphigus vulgaris, and it may also be seen in other variants of pemphigus vulgaris also. So this has been asked multiple number of times in INI-CET, and they can ask as a repeat question also. So this also you should be knowing. And one more DIF finding also you should know. This is also a DIF finding, direct immunofluorescence finding. What you can see here is immunoglobulin deposits. This antibody deposits in a linear fashion in between the epidermis and the dermis. So linear immunoglobulin deposits in between the epidermis and dermis is a classical finding in case of subepidermal bullous disorders. So depending upon that, what is the antibody being deposited, you can diagnose the condition also. If IgG is deposited, then it can be occurring in both bullous pemphigoid and pemphigoid gestationis. If IgA is being deposited, then it can be due to linear IgA disease. So with this, we will be able to find out the type of subepidermal bullous disorder, and DIF is very, very specific and sensitive investigation to diagnose this bullous disorder. This is for today. So I hope this session is useful. I'll meet you tomorrow with the same topic, immunobullous disorder, and we'll discuss some investigations and treatment for it. Thank you.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.